Welcome to This Week in Health IT Influence, where we discuss the influence of technology on health with the people who are making it happen. We are the fastest growing podcast in the health IT space. My name is Bill Russell, recovering healthcare CIO and creator of This Week in Health IT, a set of podcasts and videos dedicated to developing the next generation of health IT leaders. This podcast is brought to you by Health Lyrics, named executive coach that is dedicated to your success, that has run a $250 million budget in a $6.5 billion health system. Let's talk. Visit healthlyrics.com to schedule your free consultation. If you're enjoying the show and want to support our mission to develop the next generation of health leaders, there are 5 easy ways you do that. Share it with a peer, share it on social media, follow our social accounts, LinkedIn, Twitter, YouTube. Continue to send me feedback, questions, guest recommendations at bill@thisweekinhealthit.com, and subscribe to our newsletter. One last item, here's a question I get, do you have anyone who's investing in your career? For many, the answer to that question is no, and that's really not okay. We just launched This Week Health Daily to invest in your career. Daily videos that highlight conversations with industry leaders where I will take the conversation and make it pragmatic, something that you can implement in your day-to-day, answering the question of, so what? What does this mean to you? And so check it out. We just launched it this week. Check it out at thisweekhealth.com/daily to sign up. One of the things I'm really excited about in doing this show is as we grow and as we increase exposure is I'm getting to meet some new and amazing people. Today we're joined by Janet Dillione, who was referred to me by Karina Edwards. And I'm really excited to have this conversation. Good morning, Janet, and welcome to the show.
Thank you. Thank you.
And actually, you played golf with Karina. So not to put you on the spot, but how did you guys play?
Well, I'm committed in golf to mediocrity because I just don't have enough time. I'm an ex-college jock. So as Karina was, she played soccer, I played basketball. So, we both agreed that we don't have enough time in our lives to be much better than fairly mediocre and able to get the ball. So we had a great time. As I said, I'll get us off the tee and down the fairway. Karina's going to bring us on home on the green, and we're a great scramble team. So that's what we've set for ourselves.
So if anybody's looking for scramble partners in the next outing, that you two,
we are it. Give us those par 5s off the women's tees. We are going to bring you birdies. So.
and that's a promise. So your career journey is pretty fantastic. I'll walk through just a couple of things here. The CEO at Bernoulli Enterprises, which was formerly Cardiopulmonary Corp, and has since been acquired by Capsule. Are you still the CEO, or have you? No,
passed the baton over to a new CEO as the sale was completed.
So came in 2014, completed the sale in 2019, and as CEO. So we'll get into that and talk a little bit about that. But you were an EVP at Nuance. You've also been at, at Siemens. I'm sure there's others I'm missing here, but so Siemens, Nuance, Bernoulli, anywhere else?
Shared Medical. Started my career at SMS, Jim McAleer.
Wow. Yeah. And graduate of Brown University.
Mm-hmm.
Wow. All right. So is there any other accomplishments I should highlight that I'm missing out on?
I am the proud mother of 2 daughters.
Well, that's good. Are they also, are they at college?
They are out of college. They are, launching their own paths in their careers. So
that's exciting. I usually start with a pretty open-ended question. And this, for you, having just completed this sale and moving on to the next thing is probably pretty relevant, but what are you working on today and what are you excited about?
I have been spending probably about the last 2 months now since, completing the work with Bernoulli, really looking at what's new. I find that, with 4 separate companies, I find for some reason, I just enjoy change. Number one, I get through the change curve very quickly. Okay, let's move. And I like to do things that are very different. So I've had the good fortune to be in the EMR world. I've been in speech and natural language processing, the early days of AI. I was with real-time data and analytics with Bernoulli. So I've really gotten to see different things. And I realized that's something that I like. So as I look at what's next, I am looking to, look at some different areas of the ecosystem, most likely in the post-acute kind of distributed care areas, number one. I love to solve problems, fix things. As I like to say, leave it better than you found it. And I think there's some really fascinating opportunities to do in that, in that ecosystem where the acute care entity is now passing that patient back out into the ecosystem. I think there's really some great technologies, great platforms, great workflows emerging to try to make that integration work. And that's where I'm focusing, quite frankly.
Well, that's exciting. I mean, is there any specific problems in that area that are jumping out to you at this point?
I'm always going to be oriented around a product. So whether it's tech or tech enabled services, I'm, again, I've been through a couple things. I'm trying to avoid shiny objects. So I'm looking at, there's some differentiated tech out there that I think looks good. But nothing exactly specific at this point. There are some tough patient populations around behavioral and other aspects to me that are interesting. If you could really use healthcare technology to help, to fix, again, to leave it better, I think those are, I'm really passionate about having a mission when I go into something. So I'm gravitating towards those things, again, targeting, I would say, what I would call needy, at-risk, unmet need patient populations.
So, I think your career is interesting in that you've been with, you've been with private companies, large public companies. Is one better than the other? Are you looking for one? Not are you looking for, but is one better than the other? Are you able to do more things in one versus another?
I get that question a lot, I guess, because it's unusual. I mean, I was with, when I was with SMS, we sold to Siemens, a couple $1 billion sale. We had reached $1 billion. Nuance, we went from 370 to 930 million. Siemens was 1.2 billion inside of an $80 billion company. And then I went to Bernoulli, which was small, privately held. So I think that better or not really depends on your personality and your passions. I have consistently told people, I don't know that I could have done small and private if I hadn't learned what I did in the larger scale companies. You learn scale effect, you learn process, you learn how to build things and put business frameworks in place so that you can grow and you can build resiliency. Having said that, there are some things that are easier at big. Number one, I would say talent acquisition. There wasn't a phone call I couldn't get answered when I was with Siemens. Quite frankly, Nuance. And I could, keep, and it almost, self-regulated talent acquisition, right? You had a name, you had a brand. When you're small, number one, it's a lot harder. You're most likely a little bit salary constrained, right? Now you can use equity to try to do some things, but you only have so much equity to spread around. So I would say talent acquisition is the biggest thing. And then the other thing you have to be careful when a lot of people love to say, I'm an entrepreneur and I got that and I'm small and I want to do it, right? But when you're small and you sit in that chair, there's no one to the left and there's no one to the right. You have to still be able to do it.
Right.
And I think that's I had to learn that as I was hiring when I went to a smaller company, but I would say talent acquisition and all attributes thereof are different. Having said that, with bigger, you get scale. With smaller, you get speed from decision to action.
Yeah.
So I think if you like that adrenaline rush, then you're going to want to do that. But the thing you get in big, you usually have a larger portfolio. You have more natural leverage and risk mitigation. Every lever doesn't have to click.
Yeah, there's a bunch of things in those small companies that in the large companies you sort of take for granted. HR is going to have a policy manual, and you come in and you go, oh, we have to redo the policy manual. Just give that to HR. Well, right.
There is no HR.
There is no HR. There may not be. Legal counsel isn't down the hall. Legal counsel is third party outside. There's so many things that come with scale. And things that if that's the only place you've been, you assume that are going to be there, that all of a sudden someone's looking at you saying, oh, no, you have to do that or figure out how to get that done. So, one of the things that always interests me in terms of, the large companies, Siemens, you can make a phone call and get that meeting. But a lot of these smaller startups and they don't get to scale, and they don't get to scale because the sales cycle is so hard. How when you're sort of an unknown, you're sort of an unknown entity, but you have a great solution. How do you get started? How do you get people's attention?
I think that you are on the crux of the hardest problem to solve as a small company. And I think that it's part of the reason why a lot of the private money, PE money, VC money goes towards services and towards rev cycle, because the why. The thing a small company has to answer, just like a large one, but harder when you're small, is why should you take my call? Why should you take my meeting? And if you're in the services or the rev cycle area, usually you have an ROI, you're helping them meet a regulation. So your why answer is a lot easier. So I think in a small company, again, the most important thing you need to do is have a very, very compelling answer to that question. Why should someone take your call? And if you don't, you're not going to get the call. The next thing you're going to need, quite frankly, you need to find, you are an evangelist, and you need to find a partner. You need to have a big health system, somebody, and this is where you're using your Rolodex. You're using the trusted people that you've worked with over the years, somebody to give you that handout to get you started. You may have to do that as a CEO. That's why you have boards, board advisors. You need people to open those doors for you. But I'd say the biggest, most important thing is why. Why should, answer that question crisply. Why should someone take your call?
Yeah.
And it took me a while to figure that out.
I guess the other question I have is sales or marketing. You walk through those booths at HIMSS and you wonder, was this marketing dollars well spent? Because there's so many, and you could easily just blend into the background. Should startups be focused more on that or more on sales? It sounds like you're saying sales. It's networking. It's getting the conversations. It's getting in front of people, not necessarily trying to build the brand per se.
Well, I think when you're very small, you're sub 10 million, you've got to get reference customers.
Yeah.
You've got to sell. And quite frankly, you don't have enough money. I mean, I lived all this, right? I can't afford Chime. I can't afford conferences. You're really down in the grassroots. You need sales. So if you're on a really restricted budget, I focus on sales. I'm focusing on more net new blue signs, right? More net new units. I'm focusing on the amount of size of a per unit order to keep that escalating. Fundamentals. The smaller you are, the more ridiculously focused you have to be on those fundamentals, and sales trumps marketing.
So CEO Bernoulli, what are you looking for in your team? What makes, let's say, a good number two that's going to be right there by your side, that's going to be able to help you to get things done? And what is the core team really, what are you looking for in that core team?
Well, I think that, again, larger versus smaller. In a larger environment, it's kind of almost easier because structurally you probably are going to have a COO. If you've got multiple lines of business and you're in the hundreds of millions of dollars, the structure will kind of get dictated. But I think when you're assembling your team, whether you're large or small, as a leader, I think the first thing you have to do is really be brutal with yourself and know your gaps. So, I've got strengths, but I've certainly got weaknesses. So you have to have people around the table that fill out those gaps. So I think that that's the first thing. And I think the second thing, everyone is not going to be equal in that team. As a CEO, you are morally compelled to have a succession plan. Because if you get hit by a bus, that ship has to keep going because people's salaries are dependent on it. People are trying to feed families. So whether or not in a large company, you've got a 9-box and it's written down and it's logged and it's vaulted somewhere, there is a succession path. When you're in a small company, you still have to have 1 or 2 people around the table that are so close to you that if you were gone, they could keep the ship moving. And I think the other thing is that those people that are close to you, whether it be 1 or 2, they have to be close enough to all of the issues, because when you're managing things, you don't always want to publicly talk about everything. Cash is a tough topic. And when you're small and trying to make payroll, and figuring out whether you're going to have a 401 match and all these other things, you need a couple people around you that are close and that can manage those operating levers out there with full transparency, with them understanding what the business condition is. So, whether it's one person or two people, you've got to have some people inside of the senior management circle that are very close to you.
So because you're small, do you end up being more tactical and focused in on those, in Maslow's hierarchy and those really low level needs of getting that first client and whatnot, or are there ways that you can elevate up to the strategic so that you can really look out in terms of where you're going to go, and what percentage of time do you sort of give to the pragmatic versus the strategic in the development of a company?
I love your reference. I use Maslow's hierarchy of needs all the time. In terms of when you're trying to get a product. I mean, if I can't get a customer to self-actualization if they're trying to provide food and clothing, right? So, and housing. So I think you have to understand where your product is in that curve. But you have to have a vision. You have to see a hill. And I think one of the easiest ways to do this is to have that from and to context, right? Here's where we are today. Here's where we see the market moving. Here's how our product is going to go there. So you have to have that framework, whether you're talking to your board, to investors, or to employees. So you need to have a pathway of where you're headed. But then, you are ridiculously tactically focused. You need a pipeline. You need sales. And again, those sales are generating cash. So tactical, consistent performance, is going to drive and take much more of your frontal cortex than having the world's flashiest strategy slides.
But you do spend time. Tactical is still having a very good website, having a good communication plan, having a good message. I mean, that's like foundational, critical, tactical things.
Absolutely. But those are the ways you're answering the questions of why should someone take your call.
Yeah, I hear people from time to time say, "Well, I'm not going to waste my time on the website." I'm like, "Well, that's like saying I'm not going to."
When I got to my last company, there was essentially no website and there was no marketing because they very much believed, and they did have a very, very, they had strong technology.
Yeah.
And if the technology is strong, they will come. And I said, the guys, they will not come if they do not know who you are. So we have to get the message out there. We have to build a brand. We have to get some market acknowledgement to be able to generate the sales that are needed to generate the cash. I mean, it becomes a self-fulfilling prophecy. So,
well, you like change, so you're probably in the right industry. So let's flip over and talk about the industry a little bit. There's a whole lot of change. I want to start with regulatory. So you have CMS ONC rules. You have 21st Century Cures, TEFCA. You have it seems like executive orders on a monthly basis that change the trajectory of things. Are there any regulatory changes that you anticipate having a significant impact on healthcare and potentially an opportunity for the next round of startups?
Well, let's put a little lens on it, right? So let's let's avoid that which is political. So clearly the reg that would have the greatest impact is if someone said, let's have a single payer system, right? And that would be profound systemic impact. So let's park that to the side. I mean, I think in terms of regulatory, you look at it through, the lens of where are you in the ecosystem? Are you a provider, a payer, a vendor, health IT, pharma, or whatever? And then I think there's a time horizon. So I think in terms of time in the near term, all things reimbursement win. So if you're in the very near term and you're needing to prioritize investment money or strategies, CMS reimbursement regulations are going to win. And I think you're seeing now that Washington is really understanding its market power. So years ago, all regs were only reimbursement, right? And the HITECH Act showed, there were, clinical systems were moving at a snail's pace until the HITECH Act legislated clinicals. It made a market. So I think in the near term, and in terms of impact, the reimbursement regulations win. Over the midterm, as you look out in the midterm, what I see is, healthcare is, give or take, it's the provider space is almost going to be 100% wired with and quote unquote automated, digitized, whatever word you want to use. And yet all of us in the market know that the market itself still remains disaggregated, colonized, competitive by data, competitive by data type. So when I look at the regulations, I think TEFCA could potentially have the largest scale impact, because in my career, all markets have done the same thing, which is they've gone from best of breed to best of cluster to best of enterprise. In other words, integration wins.
Yeah.
TEFCA would essentially legislate integration. It keeps healthcare moving on the digital highway. It's really synergistic with consumerism because it'll help patients, it'll help us navigate, it'll help care coordination. So I think that, and quite frankly, as a vendor or as a potential vendor or as a startup, TEFCA would open up that ecosystem. I mean, we all know, people block competition sometimes around data and participating in that. So I think TEFCA has extraordinary complex issues to solve.
That's sort of what I want to ask you. I mean, why do we have to legislate integration? And I think in my time as a CIO, I experienced this. You sit across from different people and you're like, hey, let's for the good of the community, let's share this data. Mm-hmm. And you get pushback. And I don't think people realize that you do get pushback. There is a competitive, the competitive advantage of having the data, the competitive advantage of potentially not sharing the data still exists. I mean, I sort of think that we do have to legislate this. Is that sort of where you think we're falling down on this?
I would love to. Number one, it's certainly better. I mean, I think that CCDs and exchanging frameworks and data blocks of data are fine. I think that what we've seen now is that with scale, the regional health systems have gotten so large. If you're a patient inside of a large regional health system, you somewhat are getting protected because the health system is now so large and is probably on a single provider, vendor framework that it appears integrated. But when you have to leave that ecosystem, go out elsewhere, you see that it's still quite disaggregated. So I do think legislation is most likely going to have to be required here because people still believe that data is their competitive advantage. And it's not just in healthcare IT. I mean, I spent the last years around medtech, right? Real-time data flying around the world. There's a lot of walls around that data. That's physiologic parameters. That's monitoring and surveillance in real time. So I look at TEFCA and and again, I think you and I probably have watched over the years, like, oh, things fall short of expectation. But yeah. TEFCA could have a very, very systemic impact. And again, I think open the market for innovation, which I think is very difficult right now for small companies.
Yeah, a couple of years back, I was at JP Morgan talking to a bondholder, and they said, the company, they defined the floor for scale of a provider at about 2.5, 3 billion. And they said, if they're not at that scale, their acquisition target. These regional providers that you were just referencing, they're 10 and some of them are $20 billion organizations now. And, they're almost getting too big to fail. And quite frankly, the bigger they get, they have scale, but they move a little slower on potentially the innovation side. Is there a model on the horizon that could challenge the way we deliver care today, or upset it, or even nibble around the edges at it?
Well, let's talk about the scale in a couple of different perspectives. And one of them, I'm going to go back to a theme you kind of hinted at in that question, which is that scale has had an impact. So again, if I keep coming at this from the investor, the innovative side of this, the scale of healthcare, and you're right, I think now you have to default to their 10 to 20 billion. Those processes that drive healthcare now look much more like Fortune 100 companies because they are of that scale. So years ago, as a vendor, I could make a sale at dinner. I could make a sale on a golf course. That is so long gone. And that's not necessarily bad for healthcare, but the buying purchasing decisions are now part of large scale administrative processes, and it simply is going to take longer. And I think that an investor is going to have to be far more patient because the life cycle of a decision is much longer. In terms of the scale effect and will there be a change in the delivery process, I go back to something that we've been talking about since I was at Siemens, which is that the model of the future, that the hospital is going to be an ICU in terms of acuity. Med-surg today is the same acuity as ICU used to be. So the hospital is going to be ICU. Everybody's going to be pushing that care be decentralized and distributed. And I think that you're seeing that now. CVS and Aetna are trying to get in there, but you see it, I'm sure, where you live. The regional health centers are going to keep pushing care out into the communities. They're going to have branded urgent care centers and those things. So, and I think value-based care and providers are now facing the decision, am I going to put that community-based care out there is that my P&L, or am I going to subcontract that? Am I going to try to mitigate that risk and subcontract that? And this goes back to the old days of per diem reimbursements and those things. But so I think distributed, decentralized is going to be a theme when you talk about the model. And that, again, which begs the question of integration, which gets us back to, is it get integrated because it's one vendor, or is it get integrated because it's legislated through something like TEFCA? I think the other thing that I look at in terms of the way we deliver care, I think if I go back to the acute care setting, we have another thing happening here, which is that because it's an ICU, every admission is more complex and has more comorbidities, which requires higher levels of staffing, which would be great if there were infinite cash.
Right.
Is there infinite cash? No. Plus, there's a shortage of doctors and nurses. Okay, so now we have an extreme gap in productivity. Well, again, I think this is where you learn from other verticals. There is only one way to address that productivity gap, and that's technology and automation. So I think here comes sensors, here comes real-time sophisticated clinical surveillance across all acuity levels. Here comes a lot of remote surveillance with AI embedded, keeping track of patients across all acuities. So for those who have, I do believe that is absolutely a very real area where innovation and technology are going to have absolutely a dramatic impact, because it must. We have a productivity gap to solve.
That's an exciting future that you paint. The last topic I really want to cover with you is a topic I hope we don't have to talk about in a year from now, but it seems like every time I have someone, a female leader, a CEO, somebody who's attained the levels within your organization and within your career, I want to talk about this topic because it's still such a challenge today. And women represent a high percentage of the overall population, high percentage of the healthcare population in terms of employees and staff. And I guess the open-ended question, and now I'll do some more specific things, is why are there so few women leading healthcare, IT, tech startups, just companies in general?
Well, I would argue my quick answer would be we look like we look like most other verticals. There just aren't as many women in leadership positions. And I think that there are a couple of different reasons for that. One is the process itself is self-selecting. And I think you see this especially in boards, which is a huge avenue to get leaders, to drive leaders. Boards a lot of times are self-selecting. So if I'm at the board and, you typically are going to reach out to people who look like you, who are like, so that network is closed. So again, good board governance would say, open up that selection process, drive for diversity, because the data says diversity is a better thing for performance. And I think that, that's just a long pole in the tent. But I also think women, quite frankly, and I have been a part of this for my entire career, women are getting better, but absolutely must get better at pulling each other forward. It's just not as natural. We just don't, we joked about playing golf earlier. I mean, there's a lot of informal ways that networks are built and business is done, and it doesn't have to be on a golf course, but women must be better at pulling each other forward. They must. It's a moral imperative.
Yeah. So let's talk about that. So, there's a female listener who's saying, I aspire to be C-level, how do they get a leg up? How do they find a mentor? What's the right training? How do they get board exposure? I mean, how do they do that? What would you say to somebody? What would you say to my daughter today, who is at about 25 years old in the industry, saying, hey, someday I want to get to that level?
Well, my first guidance, and I've mentored quite a few folks over the years. Many of them have been women. And if they do say they want to aspire to senior management, I've constantly said the same thing: get to a P&L. You will not get a seat at the table until you demonstrate you can manage and grow a P&L. So go, and if I tell my daughters the same thing. I mean, a 25-year-old, get somewhere where you can learn, be a sponge, must be self-learning, but then get into operational roles. Get where you really learn the levers of the business. You're going to, some roles you're just too far removed from the fire. If you want to aspire to the C-suite, you want to run to the fire. You want to be part of solving that fire. So get to those operational roles, get a P&L as early in your career as possible.
Yeah, and running towards the fire is the way to stand out. I had a person who reported into me, who I decided to mentor later, who kept coming into my office saying, what's your biggest problem? I want to solve your biggest problem. And finally, I'm like, fine, here's my biggest problem. Go solve it. And he was able to move the ball forward pretty significantly. And I'm like, all right, I'm gonna start mentoring this person and help them to get there. It's managing a P&L is great. How do they? Mentoring is so key. It's finding somebody who's been where you want to go and developing those relationships. Are there specific areas that are specific groups that you have found to be really good to have those interactions with people who have been successful, that have been where you want to go?
I mean, I was fortunate, in my career that I guess I came up in the days of everything was so new. Nobody noticed if you were female, quite frankly. You could have been green or purple. It was just, do you have the aptitude? Do you get this? Can you get it done? I think that ideally you find a mentor within the domain where you're working, right? So that there is somebody in that senior leadership position that can help guide you. I think if that's not possible, then you're going to have to look harder and go into the industry groups and things, but places like HIMSS or Chime, and send notes. I mean, I think people underestimate how much and how often most people want to help.
Yeah.
So I always tell, don't be bashful. Send the email. Go ask for the meeting. People naturally will say yes.
Yeah, you have not because you ask not.
Yeah,
absolutely. My father-in-law is living with us, and he's 87 years old, but used to work for Bethlehem Steel. And when they used to have this program, they'd hire these people out of universities like Brown and others, and they'd bring these people in, and they put them on this 2-year track, and they served in every area. So they would serve in accounting, and then they would serve in operations, then they would serve in, literally they would get that kind of exposure. If somebody's looking at their career, do you recommend that kind of track to get a lot of operational experience across a lot of different things, or do you tell them to focus in on certain areas?
It's funny. I'm living this in real time with my own daughters. I too grew up in a company like that. We would call it the class. When I was coming up the tree, when I was a vice president, we'd hire the class of, and that class we rotated them very forcefully over 2 years to get them great exposure. I think you get that in scale companies, large employers that are quite frankly known as good employers. So I would, also give, again, I'm giving this to my daughters, get to companies that are known that they are good employers and that they grow their people. I think that that's, a powerful thing to do. And I think that if you're in your own company and you have scale, I think that, again, if you're mentoring somebody, you are getting them, you're saying your next career move has to be blah, blah, blah. And I think, again, another thing that I've cautioned or mentored or, consulted people with over the years is every move does not need to be vertical. Right? I mean, of course, you want as much vertical as fast as possible, but sometimes it's right to go horizontal, to go get that gap in your knowledge filled, that gap in your experience. It could be a global relocation to go learn. I mean, every move does not have to be vertical. And I think that's a little bit of a myth out there, which I also, argue in people to get out of your comfort zone and go do something and demonstrate that you can adapt quickly.
Well, Janet, thanks for coming on the show. Fantastic conversation. Is there any way that people can follow you, or anything you want to leave the listeners with?
I mean, I'm kind of in the transition myself, so I have a Gmail, so janetdillione@gmail.com. Like I said, I'm happy to talk to folks. I'm talking to a lot of folks right now myself, seeing what opportunities are out there in the market. But I think the female thing is a very real thing, and I would ask my peers out there. We must help pull each other forward.
Absolutely. And the role models need to keep coming on this show so that we can highlight, just the amazing work that you guys are doing. I'm looking forward to seeing where you end up landing next, and we'll have to have you back on the show after that and hear about whatever new company or new thing you're going to be doing.
That would be great. That would be a lot of fun, actually. So.
All right. So please come back every Friday for more great interviews with influencers. And don't forget, every Tuesday, we take a look at the news that is impacting health IT. This show is a production of This Week in Health IT. For more great content, you can check out our website at thisweekinhealthit.com or the YouTube channel from our website. Thanks for listening. That's all for now.